Hello and welcome to the London Perspective. I'm Stefan and I'm here to bring you the latest news and discussions that matter to our community. Today, we'll be talking about a recent study that's making headlines in the medical world. A concerning number of women 65 and older are dying from cervical cancer, according to a new study by UC Davis. In this episode, we'll be discussing the study's findings and what it means for women over 65. We'll be diving into the causes of cervical cancer and what women can do to protect their health. The study found that nearly 1 in 5 new cervical cancers diagnosed from 2009 to 2018 were in women 65 and older, and that more older women had late-stage cancer than younger women, which corresponds to lower survival rates. As per the National Cancer Institute, the late-stage 5-year relative survival rate was lower for women over 65 compared to women under 65. This is extremely concerning because cervical cancer is preventable through screening and no one should be dying from this disease. To understand the situation better, let's talk about the causes of cervical cancer. Almost all cervical cancers are caused by HPV, which is an extremely common virus. According to the Centers for Disease Control and Prevention, about 13 million Americans become infected with HPV each year. HPV is spread through vaginal, anal, and oral sex, as well as through skin-to-skin contact with the genitals of an infected person. Dr. Connie Lou Trimble, professor of gynecology and obstetrics at Johns Hopkins Medicine, says that if you've had sex, you've been exposed to HPV, full stop. There are more than 200 types of HPV, including low-risk types that can cause genital warts, and 14 high-risk types that can cause several types of cancer, not just cervical cancer, but also cancers of the vagina, vulva, penis, anus, and back of the throat. The American Cancer Society recommends that individuals over 65 years old who have had cervical cancer screenings with normal results within the past 25 years and have tested negative in the 10-year period before age 65 should not be screened for cervical cancer. Once screening is stopped, they should not be started again. But, as this study highlights, cervical cancer risk doesn't simply go away at age 65. So, are current screening guidelines for older women falling short? So, what can older women do to protect their health? Firstly, it's important to understand that the body's ability to clear HPV reduces over time. In some cases, HPV persists over several years, causing abnormal changes in cervical cells that can lead to cancer. Dr. Renata Urban, a gynecologic oncologist at UW Medicine, says that regular checkups and screenings are important to detect cervical cancer early. Women over 65 who have stopped screening based on the American Cancer Society's guidelines should talk to their doctor to re-evaluate their screening needs. In conclusion, this study highlights the importance of regular checkups and screenings, especially for women over 65. No one should be dying from cervical cancer, which is preventable through screening. And that's all for today's segment of the London Perspective. I hope you found this discussion informative and engaging. Don't forget to leave a comment.